So I'm glad you are all able to join us today. We will be talking about families affected by substance use disorders across the developmental spectrum, a protective factors approach. Our presenters this afternoon are April Frey, Katie Ryan, and Williard Wynn. And I'd like to do brief introductions for each before I turn it over to them. Katie Ryan is a senior program associate with the Center for Children and Family Futures. Katie provides technical assistance and consults on collaborative policy and practice development in systems serving families affected by substance abuse. She serves as a change liaison in the Regional Partnership Grant Program, providing technical assistance, training, and coaching to improve outcomes for infants, parents, and other family members or caregivers affected by substance use disorders and prenatal substance exposure. She has expertise in organizational capacity building, community needs assessment, policy analysis, program development, system engagement, and effective sustainability planning, and has worked with sites across systems, including child welfare, substance use disorder treatment, public health, and healthcare and hospital settings. We're also delighted to have two presenters from Riverside University Health Systems. April Frey has been in the behavioral health field for 20 years, specializing in the criminal justice involved population and working in drug courts, including adult and juvenile drug courts, family preservation courts, and several diversion programs. April has worked for Riverside University Health Systems and is currently the program administrator for their behavioral health substance abuse prevention and treatment programs. Her previous work with RUHS, which spans 19 years, includes mental health and substance abuse prevention, outpatient treatment programs, and full service partnerships. April is a licensed clinical social worker and a California Addiction Counselor Certification Board certified Level 4 Addiction Treatment Counselor, or CAP4. Finally, I'd like to introduce Williard Wynn, whose passion is advocacy for families with loved ones engaged in behavioral health services. In his role as Family Advocate Program Manager at RUHS, Will oversees all family advocacy activities countywide. The program's family to family peer support assists families to understand the intricacies of the behavioral health system and what they can expect in the days ahead after their loved one has been diagnosed with a serious behavioral health condition. Will has expertise in the collaborative court system in Riverside County, where family advocates work with families to better understand the steps they can take to support their loved one who has been incarcerated. I am very pleased to turn it over to you all.
Thanks, Dana. I'm happy to be here. As Dana mentioned, my name is Katie Ryan. Excuse me. I work for an organization called Children and Family Futures, who's the contractor for the National Center on Substance Abuse and Child Welfare, co-funded by the ACF Children's Bureau and the Substance Abuse and Mental Health Services Administration. So I just wanted to acknowledge our gratefulness for their support in the work that we do. And I wanted to share with you guys some of our learning objectives today. So we're extremely lucky to have April and Will with us to really share their experiences on the ground. And I'm here just to provide a bit of background to frame the conversation today about families, the needs of families affected by substance use disorders and across the spectrum. So we're going to talk a little bit about some of the unique needs of these families, look at substance use disorder as a chronic brain disease and understanding how that works, and then talk a bit about how implementing collaborative family-centered approaches can improve outcomes for children and their families. So first, I want to go all the way back to the basics about family development. So as we know, there's a few different models that identify sort of how families develop and how individuals develop. One is this person and environment model that really talks about how families develop and how individuals develop inside of their family systems and family systems inside of their communities and communities inside of the society at large. Another perspective on this is the social ecological model that a lot of people are familiar with, that talks about how families develop within the systems that surround them. So just wanted to recognize, that families and individuals are never by themselves, but they're in a system and in a community. And that, presents particular challenges. Every family, is developing within a different context, but I want to recognize, that families of color have particular challenges because of their experiences grappling with developmental issues, striving to develop healthy sense of self, and working to achieve their goals within the context of racism, differential treatment, heightened danger, and fear. Always want to recognize that families are have all different kinds of unique experiences, and the systems within which there we go they live are can be challenging as well. And then, of course, children develop in their relationship to their families. One of the main developmental models that people look at around the stages of development for children are Erikson stages of development that talk about that as children mature, they go through different changes, and optimal development at each stage is important in order to move on to the next stage. Erikson's perspective that a lot of social scientists believe in is that at each age there's this sort of conflict and a resolution, and a caregiver helps a child resolve those issues so that they're able to develop at their best, most optimal level, and that any interruption in any of these stages can make it difficult for them to move on to the next stage and integrate the information from that stage. So across all of these stages, it's important to recognize that disruption in navigating any of them can challenge movement on to the next stage and how a person functions as an adult. And I think for anybody who is a parent or works with parents, we recognize that while children are developing across these stages, parents are also developing in their skills as caregivers, in their visions of themselves, and in their role as their children age and grow. And so certainly skills, abilities, and supports that parents need in each of these different phases change, and parents must continually learn new things and create new capacities so that they're able to successfully navigate all of the different stages of parenthood and the caregiving roles that they need to meet for their children so that they can move on to the next stage. And just like in child development, disruption in any of these stages of parenthood can affect their developing child's ability to meet their own developmental milestones, to grow successfully, and to move towards adulthood. So as the parent grows in their parenting skills, it supports their child to grow in their development as well. And disruption in that phase of parenting can have unique challenges, can create unique challenges in the main tasks and goals, like we're looking at here. And I think we recognize sort of intuitively that what you need as the skills and supports that you need when you have an infant, you're parenting an infant, are different than those that you need when you're parenting an adolescent. And so parent develops along this developmental spectrum as well in their role as a parent. And then how do protective factors work in with all of this? I know, as Dana mentioned, many of you did the pre-work that is provided about protective factors, so we have a general idea of what protective factors are. And we're just going to talk a little bit about how the protective factors are necessary for families to have their optimal well-being, to achieve their optimal well-being. So protective factors exist across a number of domains and help shield families from stress and encourage them to be resilient in the face of challenges. Today, we're focusing on the protective factors all across the developmental spectrum and how they can be particularly well used to support families who are affected by a parental substance use disorder. In the development of this presentation, I learned that there's actually a number of different models of protective factors. The one that I'm familiar with, because my background in child welfare, was this one from CBCAP, that has the 6 domains of protective factors, including a domain on nurturing and attachment. Strengthening families, which is the basis for the protective factors training that some of you have done as pre-work, identifies that nurturing and attachment is infused through all of these areas of protective factors, infused in parental resilience, in social connections, knowledge of parenting and child development, concrete supports, and in social emotional competence. But like I said, the framework that I was familiar with had nurturing and attachment pulled out. And I do think that it's a good conversation to recognize that nurturing and attachment really is in all of these pieces of protective factors, that they're an important component, either in developing that protective factor or in using that protective factor effectively. So this is what we're talking about today, is how we can use these protective factors to support families that have to support all families, but uniquely to support families that are affected by parental substance use disorders. I wanted to make a quick note. I know there's a diverse group of professionals on our meeting today, so I wanted to note that there's another word that's often confused with protective factors that's about protective capacities. And really, protective capacities are different than protective factors in that they're focused on the individual family and often used in the child welfare field to assist in identifying safety and risk in like acute situations of child abuse and neglect. And whereas protective factors are a much broader look at the family system and the system in which families are developing, and are intended to support long-term family well-being and support to thrive long-term, versus a focus on safety and risk specifically in an acute situation. So we know some of the challenges to protective factors and to families' optimal development are risk and stress factors. I pointed out, specifically around families at the intersection, with families of color and the challenges that they face in our current system and society. But there's a range of other factors that can create stress that make it difficult for families to access or identify their protective factors: trauma, insecure housing, poverty, intimate partner violence, chronic disease. All of these things can be risk factors that make it more difficult for families to really access or learn and develop the protective factors that would most serve their family. In a couple of studies, we note that the effect of racism and intergenerational trauma can really affect people's abilities to overcome, access protective factors. There's just 2 studies that we noted here that identify that an individual's exposure to racism and discrimination increases their risk of toxic stress and can make it more difficult to access their protective factors, or there may not be as many protective factors available to them in their community, like we talked about in the social ecological model. And then another study about disparities in Native American communities that found that stress from racism and historical trauma increase the risk of substance use disorder and are a barrier to recovery, making it more difficult to find places to comfortably access the services that are most needed by these families. So understanding the role of protective factors is as important as recognizing risk factors. A protective factors approach focuses on positive ways to engage families, emphasizing strengths and what parents and caregivers are doing well, and identifying areas where families have opportunities for growth. Really, the intention of the protective factors is to work as a support and an umbrella to protect families from the risk factors that are inevitably going to be a part of their experience. And so the intention is to use protective factors to build and strengthen families and to make sure that all families have access to opportunities to grow and experience these protective factors holistically. So that was a quick overview on protective factors that I know, and family development that I know many of you already have experience with. And I wanted to give another little nugget of information before we get to talking with Willard and April about substance use disorders and how they affect families. And I think one of the most important pieces as we discuss substance use disorders is a recognition that substance use disorders are a chronic medical condition focused in the brain. Many people across their experience with substance use disorders, because of anecdotal experience or because of messages from their community, identify substance use disorders as a moral failing, something that has to do with somebody's internal motivation. But understanding that this is a chronic medical condition and it's a disease of the brain helps us understand why individuals who are experiencing substance use disorders are reacting and experiencing the world the way that they are. So just want to put that definition from the American Society of Addiction Medicine at the forefront of this discussion of substance use disorders. So substance use disorders are a chronic and relapsing brain disease, as I mentioned, that involve changes to the reward circuits of the brain and affects judgment, decision-making, learning, memory, and behavior control. And these changes to the brain can persist even after someone has initially stopped use of that substance. It's altering the brain, not in an irreparable way, but in a way that, like many chronic conditions, takes time to heal. And the main mechanism that makes this happen is around dopamine. So dopamine is a neurotransmitter in the brain that's released during a pleasurable experience. And this is for everyone, regardless of their substance use history, that all of our brains release dopamine during a pleasurable experience. Substance use can lead to a flood of endorphins and dopamine into the brain at a much higher level than other pleasurable experiences, telling the brain that it needs to continue to experience this flood of dopamine over and over again. So the brain's response is to seek out this flood of dopamine, which can almost only be provided by a substance at that level, making other things that have previously provided dopamine to the brain, pleasurable experiences like hugging a loved one or eating a food that you enjoy, making that dopamine feel even less active because of the brain's experience of having the flood of dopamine from the substance. And over time, the brain starts to seek the flood experience, and it makes other things, like I said, less pleasurable by comparison. So this is a PET image that shows repeat exposure to substance use and how it depletes the brain's dopamine receptors, which are critical for the ability to experience pleasure and reward. So this is talking about that brain experience of the dopamine flood and then the subsequent ability to process dopamine effectively without that flood experience. And this image shows that, like I said, while this is certainly has an effect on the brain and can be challenging over time, there is hope and reason to recognize the benefits of treatment and long-term recovery in the fact that the brain does have the potential to recover after abstinence from a substance over a long period of time and regain normal functioning or close to normal functioning after going through treatment and long-term abstinence from the substance. So this is the focus on the effect of substance use disorders on families. And I think there's a recognition in our community and in our society that substance use does affect the whole family. There's, a lot of different ways that apparent substance use can affect the family, from developmental effects on an infant who was exposed in utero to ongoing developmental challenges because of parents' inability to focus on their child's developmental needs or lack of knowledge of those developmental needs. There's generational effects that happen from families that have that substance use disorder is a common experience across multiple generations, making that feel like that's the sort of the norm in a family, as opposed to some other experience of having more supported relationships and more connection from a parent who is in treatment or recovery. There's the psychosocial pieces about judgment, decision-making, learning, memory that are all affected by a substance. And there can be effects on the larger family connections because a parent in active substance use may not be attending to the relationships, to positive supportive relationships that are supporting them as well as the whole family. And then the effects on parenting that I've sort of alluded to is, but want to talk specifically about are that substances affect a parent's brain and receptor systems and interrupting the reward response during interactions with infants, reducing a parent's or caregiver's motivation to engage and respond to children. It can have an effect on a caregiver's ability to regulate their feelings and emotions, which can lead to a lack of attentiveness to guidance or discipline, or can cause harsh parenting behaviors, or because of a sensitivity, an oversensitivity to a child's response. And then prioritizing the parenting role can be challenging when an individual is seeking that flood of endorphins and dopamine, and having trouble focusing on the needs of their child specifically. Just to go a little deeper on some of the challenges for families affected by parent substance use disorders on their family functioning, I think we pretty much covered all of this, but I think there's been an increased recognition of household safety concerns for individuals who are using substances. Parents may lack a focus on their child's basic needs. They also may not be aware of their safe storage of the substances that they're using. So for an infant or a toddler who may be moving around, they could accidentally happen upon a parent's substances that could be very dangerous, particularly because of their age and size. Additionally, for parents who are parenting adolescents who may be curious about substances, they may have access to substances in the home, have easy access to experimentation and not have parental guidance and support about the challenges and potential drawbacks of substance use. So just kind of lining this out, very specifically, without strong protective factors and capacities, parents with substance use disorders may struggle to recognize and secure these, create secure attachments. They may be challenged in attuning to their children's needs. They may be challenged in creating secure environments, either because of substance use, creating a lack of attention, or because of the community that's happening around their substance use. If they're selling or producing drugs in their home, it could create an insecure environment, or just a chaotic environment of a lot of substance seeking behaviors, trying to find substances, and kids being sort of brought along for that can be challenging. They may be challenged to model appropriate behaviors because their system is dysregulated from the substance use and the brain condition, and can be hard to regulate their emotions and model those appropriate behaviors because their brain isn't processing in that way. And again, I think a substance use disorder can make a parent inattentive to the things that they may have been attentive to outside of their substance use, and it can make it more difficult to be resilient in the face of stressors and risks that are happening outside of their substance use. Like we talked about, intimate partner violence. Often people use substances as a coping mechanism for trauma, for intimate partner violence, for those things, but it can make it even more difficult to attend to those protective factors and to developing those resiliencies when they're in their active substance use. So all the more reason and more importance for us to help parents on a path to treatment and recovery, and supporting them in developing their parenting role and their protective factors to support their families. So I've talked a lot. Take a deep breath here. And I wanted to ask for the group to share in the chat, but also directly to you, April and Will, and your specific experiences with families affected by substance use disorders and in early treatment. How can you balance compassion and understanding these things that we've discussed about this being a chronic relapsing brain disease, and the recognition that it can take a long time for somebody's brain to re-regulate and get back into a more regulated state? How can you balance that with the need to encourage families to access treatment and to start developing these protective factors and capacities?
So I will attempt to answer that first. So for me, when we're working with individuals who are just coming off of substances and trying to find their own balance, I think for us to remember that the brain is really in a state of renewal, healing, all of that. There's a great video out there for anybody that's interested about Addiction Neuroscience 101, and it's like 20 minutes long, but it really helps individuals understand the craving and what someone is going through as they are getting clean. And for us, remembering that many of the old behaviors may not disappear right away. One of the first things that I try doing with an individual that has just finding recovery is doing an eco map. And for all the social workers out there that know how that is, the goal is really to build that support system and help them see who the healthy people are around them that will support them in their recovery efforts. And so we try to do that from day one, because I always say that this isn't a one-time thing, that we're just going to do this once and put it away and forget it. I will bring it out in sessions and get them to continue, because it may be that they have broken relationships with family members that they have avoided because of their substance use. And so helping them build on those relationships again and mending those relationships are important in their recovery journey, and to help build some of those protective factors around them. And I'll turn it over to Will to add anything he would like.
Yes. First of all, I want to send love and thank you guys for joining us today, and positive vibes. So from the family perspective, one of our main staples here is we want to do support, education, and training to the family members that are going to be involved with this loved one's journey. And so what we try to do is educate the family on the protective factors, what's going on with the brain, and then also support them in their needs, listening to them. Listening to what they want, what is the end goal, and then also being very frank that this is going to be a tough journey for this person if they don't have the support and understanding from the family members. And so when it comes to the client or the one that's suffering from the substance, we just want to, I'm a peer at heart. So what I want to do is tell them that I'm going to walk with them step by step, understanding, know what you're going through, and just validate their feelings and let them know that, you have to continue to work on what's working for you, what's keeping you on track, what's keeping you away from the substance use. And then also you're going to be shedding. So there's going to be another side of that life that you're going to be entering in, and just give them the understanding and the knowledge that this journey, you're not going to do it alone. And me as a peer, I'm letting him know that, or her, that the family members, you have to give them grace, because through this journey, they're still learning how to support, and they might be used to the old behaviors, but guess what? As long as there's time, as long as there's effort, as long as they're understanding, we can all get through this together. So that's how I would, that's how I would probably go about this situation.
Thank you guys so much. And not to worry, you guys don't have to just hear me blathering on. We'll have Will and April back to share more. So I wanted to share just a couple more things with you before we hear more from Will and April, that are really focused on this idea of treatment. And, what April and Will both, pointed to is, this takes time. I loved April's, saying finding recovery, right? It's the finding process. It's the how to get families to this place where they are moving along this treatment spectrum and into recovery. And so that's really, I think the hopeful piece of this is that families that experience many of these challenges to their protective factors, to their family well-being, there is treatment that is effective, and there is an opportunity to get to the other side, to find that recovery. And so just to recognize that, and I would say over the last 2 decades, we've learned a lot about brain science and had a lot of great findings that give us a lot of hope, and a recognition that as a chronic brain condition, as a chronic disease, substance use disorder has a effectiveness rate equal to or higher than many other chronic diseases like diabetes or asthma when good high quality treatment is provided. So we have a lot of hope, and that's really what we're going to talk about next is what do families need in order to successfully navigate treatment and recovery. And I think the two pieces that we here at the National Center focus on a lot are family-centered approaches and collaboration, because we recognize that families don't come as individuals, they come as packages. And just like we talked at the very top of this conversation about that socio-ecological model, they come in systems and communities and organizations and societies that all have an effect on how they're able to access and move through treatment and recovery. So the focus on a family-centered approach to substance use disorder treatment and recovery really is a recognition that that treatment for families needs to address all of the different aspects of a family's experience and all of the members of a family. And that brings us to the question, who is a family? And ultimately, systems and programs and agencies may define families in a variety of ways, and families can be diverse, made up of nuclear family members, extended family members, blood relatives, non-blood relatives, and families come together in all of the unique ways. And that what makes someone family cannot really be defined by, one person's definition or DNA or those kind of things, or even a legal status, but that it's about that bond between individuals and the support that they need as human beings. So it's important to us to recognize that a family-centered approach recognizes and accepts the individual's definition of their family and respects that definition of family when they're when they're determining who to include in their treatment and recovery approach. And one part of a family-centered approach is family-centered substance use disorder treatment that really focuses on encouraging engagement into treatment services, retention, increasing a parent's parenting skills and capacities to overall affect the well-being of the family. The recognition that child safety and parental recovery are critically linked to one another is a really critical piece of making sure that treatment is addressing the needs of the family holistically for the best outcomes for the entire family. So when we talk about a family-centered approach, systems and individuals working with families who are affected by substance use disorders, first of all, as we've talked about, there needs to be a recognition that this is a brain disease, because the way that you treat a chronic relapsing brain disease is different than you might treat substance use disorder if you see it from another perspective. Rather than, as opposed to like people who may see it as a personal failing or a chosen behavior. It also can reduce stigma, and that can improve engagement and access to treatment, to effective treatment services when we reduce the stigma around having a substance use disorder. A family-centered approach also, as we know, it extends to every member of the family and the needs of the family. Like we were talking about, a parent develops as a parent, a child develops in their developmental phases. A family-centered approach recognizes that all of the individuals in the family and at their developmental phases that they are in need to be addressed through a variety of different modalities that are going to work for those individual members. And it also recognizes that in order to really have that family-centered approach, it requires a number of individuals to be on the same page about really supporting the family. That parents and children live within the context of their larger family systems, and they exist within these communities and these cultures that need to be addressed. And so there needs to be a wide service array to meet all of the needs of the family members around their experience with their parents' substance use disorder, and to address the challenges that may have developed during the time that their parent has been in active use and in early treatment and recovery. So just looking very specifically at the protective factors and the recognition, some of the treatment modalities and services that can be provided to support them. Knowledge of parenting and child development as a protective factor can be addressed through parent training and education. Nurturing and attachment through family time. A lot of times people call this visitation. It's important to us to call it family time, because if a family has any need to be apart for the safety of the parent or the child for a time apart, that time together is absolutely critical. And if a family can stay together safely, even better for that family, because that's an opportunity to learn about nurturing and attachment through individual and family therapy and supported modeling and practice in those therapy sessions or in those group sessions. Parents can learn social emotional competency, nurturing and attachment, and use that in their interactions with their child. Through individual therapy, of course, individuals can identify their own trauma histories that may be and mental health challenges that may be exacerbating their substance use disorder, or making it difficult to move into treatment and recovery. Family therapy can address some of those, like we were talking about, psychosocial issues and social emotional development issues around how a parent can support their child in their development as they move forward. So all of these are services that can support families in a family-centered approach to address the needs of developing and enhancing their protective factors. These are a few more. We talked about some of the other protective factors around social connections. April talked really eloquently about sort of how to support families to reestablish those connections, strengthen those connections if they've been broken or strained during their active substance use. Concrete supports, many of the concrete supports, like supportive housing or even access to childcare, can be denied to families who are in active substance use or not available to them. So reestablishing relationships with providers and helping providers recognize the needs of families in early treatment and recovery to be able to access these services as support to build their family, to strengthen their family and build back those relationships can be really important. And then additional supportive services like aftercare, creating a recovery community, safe connections, like April mentioned, and those additional supports among their family systems, like Will talked about, are all very important to enhancing their protective factors and enhancing the well-being of their families. I think you guys are probably recognizing a trend that we're always trying to recognize, that many of these challenges that families with substance use disorders are challenged with are exacerbated in a society that continues to perpetuate systemic racism and individual racism. So just want to recognize that there are unique aspects of family-centered approaches to ensure that equity is provided to all families, and ensuring that there's culturally competent and responsive substance use disorder treatment with providers that recognize the needs of families for traditional services, traditional to their culture, to their life experiences, and that they recognize that access has not always been easy for all families, and to be more mindful of the barriers and biases that may make it even more difficult for families of color, families that are not sort of the heteronormative family systems, to access some of these services. So constantly having that recognition is critical to making sure that all families have access to the services, to the family-centered services that are needed to improve their outcomes. Again, there's a lot of pieces to this, and I think this can sometimes be the challenge that communities feel. They feel overwhelmed by family-centered approaches because there are so many partners needed and services and supports that are necessary. But as complex as we are as humans is how complex our needs for support are. So I think people recognize that all of these pieces are necessary for families to be successful regardless of a parent's substance use disorder. When you layer on top of that the challenges that we've discussed about, a healing brain, having strained relationships, having challenges with parental development and child development. There's a whole nother layer of services that are necessary to help families get through treatment successfully as a family, and on to sort of that positive recovery, to find that recovery. And so I want to make sure that we're, giving appropriate space and consideration of the fact that families go through a treatment, and sometimes that has a lot of different components and can take a while, but there's a piece after that too that's about a family's recovery, and how do we make sure that we're continuing to support families in our systems, in our organizations, in our communities, so that they're able to not only make it through treatment successfully and get to the other side of that, but continue to get the care that they need to recover as a family, and to make them whole again as a family. Certainly focusing on solutions that respect people's values and beliefs and experiences are critical to long-term recovery. There is a lot of evidence. This is just a few studies that point to the fact that when we look at families holistically and address the needs of both the parent and the child, of extended family members, of the whole family system, that the outcomes are much better. Families do experience recovery, long-term recovery, and positive outcomes and long-term well-being, but it requires that we address the needs of the whole family and the whole family system in order to get those positive outcomes. We talk about in our office a lot about recovery capital. What are the things that a person or family needs in order to have successful, sustained recovery? And these are from a different research study and a different look at what is required for people to have long-term well-being, and they align a lot with the protective factors that we talked about at the beginning, of what somebody needs in order to be successful and be resilient, are many of the same things that they need in order to have a sustained recovery. So these things really align well if we recognize that a family with a parent or caregiver who has a substance use disorder is at its core a family, and the substance use disorder is one of the challenges that they need to overcome for their long-term well-being, like any family. So as I promised, I'm going to stop blathering on, and I'm going to hand it over to Will to talk to us a little bit about the work that he does working with families and that holistic system that we've been discussing.
Thank you, Kate. So I work as a family advocate, and my main purpose here is to make sure that I advocate the family's needs, be that voice for them. And so our family advocates, our approach is to walk side by side with the families going through these strenuous tasks and strenuous events that happen in their life. And so one of the main things that we try to do is we have a whole person care. We want to wrap our arms around the problem, but we also want to wrap our arms around the whole family as a whole and address individual needs. Also, through that, a lot of our family members don't understand the process of going through what substance use looks like, or doesn't know the process of going to a clinic and addressing all these things at the clinic. And so what we do is we walk side by side with them, and we train and we educate them on what does it look like? What is a treatment team? What does recovery look like? What does it look like when your loved one has to go into treatment? And while they're in treatment, what should you be doing? Because 9 times out of 10, they're going to return home. And so we also hold different meetings. We have a siblings group, which we address the issues with the siblings who have a loved one that is going through a substance use challenge. And so, many times the siblings, they're kind of left out, all the attention is on, my brother or sister who is going through this, I'm the one that's doing good. And so we have a siblings group, and we kind of address certain things of what's going on and how to be supportive and still be successful. And then we have what we call our family presentations. We do this every other month. And one of them is like Meet the Doctor. And a doctor or a psychiatrist would come out, present to our family members, and talk about the medication management, the effects of medication. What does that look like? And how to make a simple appointment. You never know, these issues come up, and we're trying to reach these families and let them know that there's a baseline, and let them know that there's a really holistic approach to this thing. And then also, although we do the meetings, we invite law enforcement out. How's your interaction with law enforcement if you have to call law enforcement on your loved one because of their behavior, and how can we help law enforcement out, and how can we help you guys work together and have an successful call to get that person the help that they need. And then finally, we just follow up with our families and make sure they're doing great. We have follow-up treatment teams. And then also we have follow-up meetings where and groups where we have family members that have been in there for a long, long time and that are being very successful. And we're putting with our new families that are just entering this journey. And it works a lot because they feel like they're not alone, and they have somebody who's been there and done that. And it extends hope, and we hold the hope for them. And so overall, family advocates, we just advocate for the families, and we just try to teach them the nuances of going through, a health system as we are. And so it's been very successful, and I'm really proud of the work that we're doing.
Will, would you care to share how some of our family members that come into your groups and your program, they come to us before their family member who's using actually does at times? So they're already starting their recovery before the person.
Yes. Yeah. So many times families will reach out to us, and when they notice a difference, they're just so eager to learn and be there for their loved one. And so, but they don't know what to do, and so many times we try to just, collaborate. We collaborate with April's team, and we try to collaborate with other systems that are in there that will have touched this person as far as like getting substance use treatment. And so being proactive is one of the great things that happens. But sometimes I'm also over our family resource centers. And so a lot of time, these young men and women, they will come in and get resources. And then, it's a peer ran, it's non-therapeutic. And they tend to open up more. And then what happens is they start divulging information, and then that's how we connect with them. And, we walk with them hand by hand and ask them, have you tried this before? What does your recovery look like? And these are people who are in recovery that work in there, so they can tell them about the journey they took, because we know my journey is going to be different from yours, but I might have a little bit more information to kind of push you and get you to where you need to go. And so it's a very, very great, very, very great program. And I love to see them walk in and asking for help and different things of that nature. And when we're able to support them at the grassroots at the bottom. Yeah.
And then Katie, if I can say one more thing, because there's a comment. I know we always think of substance use as the one individual. And it's not the case that substance use is a family disease. It may not be the whole family's using, but everybody has had to adapt to that one person who's using. So maybe it's the spouse who's calling the job to say that, they're sick, they can't come into work. The kids who are trying to pick up, and help mom more to keep the house going. We know that everybody adapts in the family to try to protect the family. And so the recovery process has to be a family event also. And so that's why we in Riverside believe the sooner we can get the family involved into the process, the better the family is going to be. Everybody gets what they need. So even if it's a parent who has a very young child, so a mom who has a 2-year-old or a 3-year-old, we have perinatal programs where they can bring their child with them, and we're giving them parenting skills and hands-on child lab and extra treatment components to help them in the process of recovery.
Thanks, April. I think that really highlights exactly what we're talking about, the whole family care, and you guys do an amazing job of providing that whole family care and recognition of the needs of all of the families. And like you said, April, you know, the whole family has adapted to the parent or an individual with the substance use disorder, and now has to readapt to their new life together and all of those things. I think there has maybe in some communities or historically been a sense that you have to treat the parent or the individual substance use disorder first in the absence of their family in order for their recovery to happen. But what I think we've seen, and I think you really, you know, eloquently put here, is that if their whole family isn't addressed, then they aren't adapting. The rest of the family isn't adapting to the new experience of that person as they're going through treatment and recovery. So I think that's really important to consider, and thanks for that, for highlighting that for us. Before we move on to the next piece, which is about how do we do this family-centered approach and in our communities, was there anything else here that you guys, that Will or April, that you wanted to share?
Oh, I would just like to share one more thing, like April stated earlier. This person that's going through recovery has new behaviors, and a lot of times the family gets stuck in the old behaviors. And then we have to realize that, you know, when we're doing this journey, they're going to have to kind of get rid of those old behavior, thinking that this person is still the same person, because they're growing every day, and it's their journey that eventually is going to be their responsibility to take care of their own recovery. But it's tough for families to understand that, because they get stuck, you know, and when you get stuck, you know, that kind of hinders somebody else's growth. And so, like April said, it's really good that we can do an intervention before this person really gets into it, because a lot of times, you know, that person is getting their new, you know, their new skills in order, and they're getting their new techniques that they learn to be successful, and family is still stuck in the, you know, well, we're just waiting for that person to fail, or, you know, they're doing good now, but they did that last 2-3 times, you know. And so it's all about education and supporting that person from the ground level. Yes.
And the last thing I'd like to add is, we do see sometimes from our family members where they think, okay, so they're clean now, they've gone to treatment, and everything is going to be fine. But as I said in the very beginning, we start having them look at their environment. So what are their support systems, building some of those protective factors. And when they start implementing some of those 12-step meetings or whatever they need to continue that support, because treatment ends. However, when they build that support system in a self-help community, that can go on as long as they need it. Sometimes some people attend those on a regular basis forever to stay sober. But sometimes the families will get resentful. You were gone because you were using, and now you're gone because you're going to meetings. And so the important piece that we have to emphasize with them is that if they don't have their recovery, then they don't have anything. Everything else disappears, the family, the job, you know. And so just helping them see how important that those meetings are to them for their continued sobriety, and helping them, you know, find their own support of what they need in the process.
Yeah, and I think, you know, we sometimes in a non-treatment world call it self-care, or we say to new moms, you can't pour from an empty cup, or from parents, but it's the same in recovery. When April talked about this when we met before this session, and she said that, I was like, that rings so true for me. You know, I hear often, oh, more self-care, you can't pour from an empty cup, those kind of things, but it's critically true, right, for families and parents who are in recovery, that they have to do what they know is right for them in order to maintain their recovery. And when we have this whole family approach, and the families involved in this treatment and getting their own services and involved in the process of treatment and recovery, then they can recognize and hear how important it is for that person to focus on their recovery, I think. And like Will said, you know, have some attending to their needs as well, and not feel like I'm just this adjunct person over here on the side, but I'm a part of this family system who has had challenges and has been hurt and has experienced pain, and I need to process that as well. So that whole family approach gives that opportunity, and you guys do that so well. So thank you for sharing that and for talking about it. The next piece that I wanted to share real quickly that aligns exactly with what we're talking about here, and the recognition that families have a variety of needs, and that substance use disorder treatment is just one of them. But there's this whole constellation of needs that a family that has, and Will, spoke about that, as did April, about sort of all of these different pieces and services that they need, and how to connect into their communities and the services that are available, and repair relationships with some of these organizations or systems if those things need to happen. And having that support is absolutely critical. And in order for organizations to do that, collaboration is really necessary. I think, as individuals who work with family resource centers, you're well aware of the need for collaboration, but sometimes collaboration is hard. Our saying here is, if you want to go fast, go alone. If you want to go far, go together. And I think we recognize that we want to go far with these families. We want to help them into treatment, into recovery, into long-term well-being and thriving as families. And so that really requires us as organizations and service providers to collaborate effectively in order to make sure that all of their needs are met, and that they're met in our systems with care and compassion, so that they're able to access the services that they need. So, we recognize that that substance use can be a multi-generational issue that affects families across multiple generations. And so it really requires a system that addresses the needs of the whole family. We talk about, there's the levels of collaboration. There's collaboration for an individual client about sort of what are the unique services and the unique service array that they need and that they need to access, and that case planning, where we work with other providers to make sure that that they're getting all of the unique services that individual family needs. But there's also the systems collaboration, right? Our organization talking to your organization, making sure that families are able to easily move between different systems, that their needs are understood, that their chronic relapsing brain condition is understood, that they're met with empathy and compassion at all of the service providers that they go to, and that we are cross-training each other so that we understand the unique needs of the early childhood's care system, that we understand child welfare's needs, the court's needs, that all of our organizations are sharing information across the organization so that we understand the goals, motivations, and needs of our partner organizations, so that we can really focus on how to work together to address the needs of the families. So of course, collaboration requires communication, which it feels like such a of course kind of answer, but we know that communication can be very hard. People are busy, people have different needs, people are concerned about sharing information if they don't have trust with other partner organizations, and they don't know for sure how a client is going to be treated or responded to when they enter that system, or if information is shared. So it requires a lot of trust building among us as organizations to create a web of services and providers that trust each other. Then there's the coordination. We talk often about parents, particularly parents who are involved in child welfare, but I think parents who have any variety of challenges, trying to access all of the services that are either needed or expected in a case plan can be extremely overwhelming, with therapy appointments and childcare and employment services and individual treatment and family therapy and parenting classes and support. I mean, so AA support meetings, peer support meetings. There's so many things that we are asking of clients in order to meet the expectations of a case plan or of their treatment, but that recognition that we have to be coordinated as organizations of what we're asking and what we're hoping that service that we're trying to provide is going to really offer to the family in coordination with their other services. I think about it like as, the homework, when the English teacher gives you homework and the math teacher gives you homework and the history teacher gives you homework, how can you all get it all done with quality? But if all of us are talking together and talking about the treatment plan and the outcomes that we're hoping for a family, then we're able to coordinate and say, this is the right fit, and they don't need to go to this Tuesday meeting, or here's how they're going to do transportation, but really coordinating our services so that the needs of the families are addressed and the reality of what it takes to access all of those services is considered. And then, consultation. And I think this is for me a really important part of what we do in collaboration, is recognizing and respecting the expertise of our colleagues. I know that there are judges who have a lot of expertise. There's also nurses who have a lot of expertise, but they're different. And there's child welfare staff who have expertise in safety and risk assessment. But then there's also, early childhood providers that have expertise in child development. And so I think it's really important to consult one another and respect the expertise of those people in your collaboration and in your team, so that you don't have to do it alone. You don't have to know all the things, which none of us can, right? But when we have those partners that we're consulting with, we can really get a higher level of services for our clients, and not take all of the responsibility on ourselves as professionals to be able to do all of the things. We talked about these barriers to collaboration, the communication and trust, clashes with different visions of missions for what they're, who is the client? Is the client the kiddo? Is the client the parent? Is the client the family? Trying to understand the needs of each of those and the primacy of one over the other, or how to balance those things, can be challenging. So making sure that we understand our partners' missions and their goals and what they're trying to achieve is really important to having a coordinated response. And then engagement, like I talked about, making sure that all of the partners in your collaboration have compassion and empathy for the clients that you're sharing, so that they understand the unique challenges and needs of the families, is really important to making sure that clients get engaged in the first place, and that they stay engaged in the services long term. We talk about the stages of collaboration in our office a lot, and I think you guys probably have had experiences in many of these different stages of collaboration. But I think this is interesting because we talk about the development of a collaboration, just like we talked about the development of a parent, of a child, of a family. We're developing as collaborative partners as well in our communities, bringing together services and expertise and sharing and building trust, much in the way that families are developing, that our collaborations are developing as well. And we have to keep them on a positive developmental trajectory by making sure that we are supporting each other at each stage along the development of a collaboration, so we can get to the point where we can change the way that the services are provided to clients, the way that the system is providing services to clients, to be more coordinated, to be more accessible and more engaging. And we know that meaningful collaboration with communication and information sharing, common values, and shared outcomes can result in increased engagement for families in treatment, fewer children being removed unnecessarily from families, increased family reunification if children do have to be removed, and fewer children re-entering child welfare or having subsequent abuse or neglect cases, and ultimately families not becoming involved with the child welfare system at all if it's not necessary. So I know, Will and April, you guys work with a lot of different partners. You talked about it sort of at the client level. I wanted to hear a bit more, if you are willing to share, about sort of your collaboration and your experience with collaboration in your community.
Sure. So I'll start out, Will, and you can bring us home. Does that work?
I'll try.
Okay. So in substance use, because we have so many different collaborating partners. So, as you added in the beginning of your PowerPoint, ASAM criteria really does kind of guide where a person will be put into treatment. So whether it's outpatient, intensive outpatient, residential treatment, detox, whatever the medical necessity they meet, we have many contract providers that we work with. And so they are our partners. We are one big team, and it's about making sure that the client gets to the right place at the right time. CalAIM is a big initiative across California that is changing the way we provide services in behavioral health. And so it's really focused on no wrong door. It doesn't matter where the person comes in. It's about getting them to the right place, to the right service and what they need, treating the whole person. And then it's also about integrating services. So no, we can't do all of it by ourselves. We need our partners. We are a team. And so valuing our contract providers, our program also works with our medical center. And so we have an OBGYN at the medical center that will work with our pregnant population. Someone that we identify has a substance use, he'll admit them into the hospital, start detoxing them or putting them on MAT services, and then our perinatal navigators get them to the right facility for them to complete and continue with treatment. We work with our community health centers. Many of them have not seen a doctor in who knows how long. And so trying to get them connected, first getting them benefits. Many of them might not even have Medi-Cal or any kind of health insurance. So helping them get connected to that with the medical plans, then connecting them with community health centers, our FQHCs, where they can receive medical attention, their children, their whole family can, anywhere from vision, dental to physical health. Of course, working with Department of Public Social Services. And so in many aspects and programs, we have a lot of partnerships with DPSS and work very closely with them. Public health home visiting programs that can go out and help them in their home and provide guidance and parenting. We have probation that we work with, our collaborative courts. So we have a family, Katie talked about our family preservation court. It is pre and post file. So the person doesn't actually have to have a open case. They can refer them to us prior to that happening, and we can get them on the right path before they do the children are removed. Educational partners, sometimes it's helping them get connected so they can get their GED or get connected for other services. Our moms programs work with some law enforcement agencies that can provide car seats for individuals. And so knowing what those resources are within your community. And of course, our partner, which is actually with behavioral health, our housing partners. Finding somebody who is homeless or that is going to be leaving treatment and has nowhere safe to go, and being able to link them to some kind of housing is critical in helping them in their recovery journey. Did I miss anything, Will?
No, you did not. And so in addition to what April, I'm also work with the same agencies that April works with. In addition, Family Advocate, we work with NAMI, National Alliance of Mental Illness, and we encourage our families to do the family to family classes, which gives them a basic education of what mental health looks like, and they have a substance use part. We also collaborate with CalFresh for our loved ones that are homeless, that have a substance use addiction, and it helps them kind of get back on their feet and get some healthy eating, because part of being in recovery is being healthy through in and throughout. Also too, with our pantries in our location all through Riverside County, we work with our pantries to make sure that we can provide food for those who are in need, low-income families. So I would think those are the three additional ones that I would add to it.
Thank you guys so much. April, it looked like maybe you had something else. I didn't mean to interrupt. You're like, no, please, no. I know you guys do so many amazing things. I'm sure, you know, we could go on for a while about all of those relationships. And what somebody mentioned in the chat, and I think this is a challenge that a lot of people have, is that they feel like they're challenged to partner because of, you know, really busy caseloads and overwhelming needs of families. How have you guys overcome that?
I don't know that I could say we have overcome it.
Right.
We still have those challenges. One of the things, especially with our department, our CFS partners, really following up with emails. But also I think, you know, some of the challenges is understanding that everybody has their own goals, their own perspectives, their own expertise, like you said, Katie, and respecting that other agency's expertise, because we don't all come from it from the same viewpoint, but it takes all of us to help somebody get on their feet. And so, you know, many of us, we have different missions, and respect the other agencies. And then we also, each agency has different regulations. You know, often we will get phone calls and say, they need to, why can't you make them go into treatment? And it doesn't work that way. It's voluntary. And, you know, we even have to tell law enforcement the same thing. We're able to put together a sobering center, so law enforcement, if they just find somebody that's under the influence, they can just drop them off instead of having to take them to the drunk tank. You know, they can bring them to us and we engage in conversation. But ultimately it comes down to a person has a choice whether they want to do treatment and whether they want to recover, and we have to respect that choice. Now, there's always consequences, good, bad, and indifferent to whatever their decision is. And so we, you know, just use MI, motivational interviewing, to try to engage them and tell them what's available, and that remind them that we're always here. Today may not be the day, but tomorrow may be. And so know that we're here for you if you change your mind. And then again, you know, I heard the HIPAA confidentiality, and in substance use, we have 42 CFR Part 2. So it's HIPAA on steroids is what I call it.
Yeah.
And it is for SUD services specifically, which restricts us even more. And so know when you call a facility and say, I need to know about this, you know, my client or whatever, if there's not a release of information, we're not trying to be difficult. We just cannot. With the rules tell us we can't. And our consumers get to make that choice, whether we get to talk to you about what's going on with them. So we always encourage them, because we say, if you don't sign the release, we can't tell them how good you're doing either. So, you know, we remind them of that.
And I think, you know, those, like you said, there's 42 CFR, there's HIPAA, there's those regulations. I think on the systems level, when you have those conversations with partners and they understand, like you said, we can't share this information unless we have this, you know, assigned, you know, consent, and it has to be very specific and those kind of things. I think that's a piece of where this collaboration at the systems level comes in, like those conversations happening before the need, I mean, of the client is, you know, really important, that the systems understand the limitations of each other. And like you said, the word doesn't want to come out, respecting somebody's expertise is really important, because then it doesn't always have to just be on you, right? You have these intense caseloads, but if you understand the other organization, if you have a relationship previous to that need coming up and that intense caseload and that individual client, if you already have a relationship with another organization and you know they can take care of this issue that this client is coming to you with, and you know that they'll take care of them with care and compassion, then you can make a referral. You can make a referral that you feel good about when your plate does become too full. So certainly takes some work on the back end at that systems level, but there's some potential relief on the other end to be able to have partners that you trust and respect their work and recognize their abilities and can refer clients to them when they really can meet their need the best. So I think that's an important perspective.
Yeah, and also too, we try to do aftercare continuum, because a lot of times we do make referrals over, and we don't want our clients to fall through the cracks. And so it's very important for us to continue to have an open relationship with our partners and making sure that we are collaborating, so that our clients do not fall through the cracks. And so it's very important that continuously have phone calls, continuously do visits over there, and just be present with your collaborating, with the agencies you're collaborating with. It's just, keep up a good, healthy relationship.
So I think this is mostly our content for our session today. I want to encourage you, as we've had this conversation, and April and Will have shared some of their amazing experiences and the amazing work that they do with us, to think about what your next step might be. If you know the substance use disorder treatment provider in your community, and if you don't, making an opportunity to find out who they are and learn about their services, what kind of services they provide. We hear a lot of times from people who don't work in systems that are well connected with their substance use disorder treatment partners, that they're afraid to ask clients about their substance use because they don't know what to do next. It feels overwhelming and pretty intimidating to ask somebody about something as challenging as a substance use disorder if you don't know what's next, if you don't have a partner that you're handing them off to or that's supporting you in providing them the services that they need. It can feel very overwhelming. But many communities have wonderful treatment partners that are doing great work, peer provider organizations and programs like Will's talked about. So I really encourage you, as a potential next step, to consider, finding those partners in your community. If you know those partners, strengthening that relationship. Will mentioned going and visiting collaborative partners to see what they're doing at their organizations. That's a great way to establish a trust relationship, to begin establishing that trust relationship, to understand their services, to understand their challenges and their goals. So there's a lot of potential next steps for your work with clients, for your work with collaborative partners, but I think there's a lot of opportunity there, and I hope that you guys have found something from the conversation today that's helpful. I want to let you know from our organization, the National Center, I know somebody mentioned in the chat I was talking really fast. I do sometimes, well, not all, I all the time talk really fast, so I apologize. But I think part of it is because there's so much great information out there, and I always feel like I have more to say, and I always want to leave space for, people who are really doing this work on the ground, like April and Will, to share their experiences that are far more valuable than any resource I could ever write or provide. But I do want you to know that we have a plethora of resources that we would love to provide to you on all of the topics that we talked about today, and a lot more. And I feel like one of our greatest resources is the extensive network of providers that we get to work with across the country, across the state and across the country, to make peer-to-peer connections and to share their unique experiences. Will and April and I just met in the last few months through one of my colleagues that, helped me connect with them. And that is one of the great things about my organization, is that I have colleagues that have worked all over the country and work with partners all over the country that can bring their expertise to the table. And I really appreciate Will and April, you guys providing all of that input and perspective that's so valuable about the work that you do.
Thank you for having us, Katie.
Thank you.
Just want to thank Katie and April and Will today. I'd echo Katie in saying that having April and Willard provide their perspective and their insight from working within Riverside University health systems and across partnerships in Riverside County really does make an impactful difference in understanding what this looks like at the community level. But Katie, we also really appreciate how you put everything together from a subject matter expert standpoint. Everything really flowed really nicely today. And I think that is reflected in that we have no questions. I don't think it's that people didn't find this really compelling. I think that you really covered all of the bases. Saying that, if anyone does have questions, do still feel free to throw one out there before we close. As I hit a couple of points. There will be a certificate for this training. You just need to complete the brief survey that will be in the chat. And we saw a number of questions in the chat about the recording and the slides, because again, I think people really appreciate it and want to share this information. We will be sending you an email within the next 2 days that will have all of that. Will also be available in our training archive on our website. So if, for example, you have colleagues or you are in a collaborative partnership in your community, you can send them out to caltrin.org to find that information or simply forward it on to them. And the other thing I would say is we saw a couple of times in the chat today folks who shared community level resources. We love to see that. And in fact, if you have related resources, do feel free to send them on over to info@caltrin.org. We always do a follow-up email about 2 weeks out from these trainings with additional resources. And we'd love to share resources from other counties. Because I know that as you're working through this training, you're thinking about how things look in your organization or in your county as you listen to Riverside. And we're happy to provide resources from other counties as well. And then finally, just watch your inbox for the next issue of Caltrin Connect. Many of you probably saw that arrive in your inbox yesterday, so you'll see it again in about 2 weeks. But that's where you'll find upcoming trainings on a lot of different prevention topics to make sure you continue to stay engaged with us. So again, I thank all of our attendees for joining us today, and especially our presenters, Katie, April, and Will. Thank you so much for all the work that you put into this. We really appreciate it.